Enoch Cremation, it's in Treaty 6 territory. There's approximately 2,700 people living on reserve. I think we do around 70 home visits between all of us a week, 70 to 75. So that's a lot of people we see.
A lot of our home visits include wound care, medication administration, daily living assistance. Occasionally we do wellness checks if somebody's feeling unwell, even if they're not a home care client of ours.
The biggest thing that we found was not having enough time for clients because there's a lot of paperwork to do. And with 70, 75 visits a week, you fall behind a lot on the paperwork as well.
When you kind of get to focus on charting, you know, I find if you can kind of get into a rhythm and start getting it done, it starts to flow. It's really difficult to do that though, you know, because there's always like a phone call or a visit. So you kind of have to stop, put that aside, and then try and go back to it. And so sometimes I found that really challenging.
When I was first told about CliniQuill, they told me that it would help with my charting, so that it would be less time on the computer and more time that I could spend on client care, which really drew me to it and made me want to give CliniQuill a try.
I think CliniQuill, you're never going to miss a note, you're never going to miss information from the patient or the patient's caregiver or family or friend. So it kind of closes the gap between missing information or improper charting and improper documentation.
CliniQuill has made a really painful point for me, which was charting, a lot easier. It's kind of fun to do charting now. Just go over the note and make the changes that you need to make, and it's all done.
I mean, you do remember, of course, what your client says, but going back, even weeks later, months later, and going back and looking at, how your client was feeling that day or what their pain level was, and it's 100% accurate because it's straight from the client's mouth to your documentation. It's definitely helps complex client cases.
I had to go to a case conference at a hospital for one of my clients, and there were 6 professionals there all talking about the client, and I asked them if it was okay if I used it, and they're just like, yeah, no problem. So I started recording, and it was able to distinguish each individual person that was talking and keep track of what they said, which was wonderful for me because I couldn't remember what half of them said half the time. So and then I was able to keep track of it, and I was able to update the client or remind the client or help them out as their liaison, and to talk to the family about it as well. CliniQuill has really helped me with my patients and my client care and my charting, and I'm really looking forward to continuing to use it and to seeing what they develop as they go along.
No, I'm really happy with CliniQuill and the time it's saved me and how it's impacted my practice, and yeah, I'll definitely be using it going forward, and I wish everybody had access to it because it's great. So,
actually really excited to see what other templates and services that are going to become available, because it seems like there's always more being added. So really excited to see what else is to come.